Good afternoon. I am honored to participate in this event, to be part of this distinguished group and representing the Jarvik Heart Company. Jarvik Heart offers some unique technologies. One of them that is amongst the most significant is the fact that offering not only an abdominal driveline but also a post-auricular driveline presents to many patients, in particular those who are destination therapy, a unique improvement in quality of life. Thank you. Daytime, the simple controller and a battery, and at night, two batteries to provide 8 hours each of electric support to the patient. We have now at Jarvik Heart implanted 1,072 Jarvik 2000s in patients throughout the world as of 2 weeks ago. By year and by country, I will share that with you as well. Please note some of the statistics that have significant clinical impact. The fact that the Jarvik 2000 displaces 25 cc. The other two VADs in the market today displace 50 and 80 respectively. The pedestal from which the post-auricular driveline is mounted has a lot of comparisons when you see it from a distance to a cochlear implant. In other words, a patient who has hearing disorder that is not achieved through a hearing aid. And so it looks somewhat similar. It's metal against metal, and this is one of the reasons why the infection rate is so low, which I'll get to in a moment. Here are our data comparing infection-free status of the post-auricular driveline. This permits patients, it sounds so simple, but it permits patients to live a normal life and bathe every day, shower, and in fact, even swim, which we'll get to in a moment. If you recall the comments made by Dr. Ferraz yesterday at King Faisal Specialist Hospital, Riyadh, he recommends changing the abdominal dressing 2 to 3 times a day. An example, a patient in Belgium who has placed his controller and battery on a disc. It allows him to exercise swimming. A patient in Utah who is enjoying a quality of life despite his advanced age.
Il n'y a pas de pansement, il n'y a rien. Je me lave les cheveux normalement, c'est étanche, donc je peux aller à la piscine. Par rapport à quelqu'un qui est à l'hôpital,
to appreciate how this patient is able to enjoy a normal quality of life and do his daily swim at the local pool. And by the way, full disclosure, the young lady is the patient's daughter. Our data shows a 1.8% of the patients with any driveline infection. Our colleague from the Netherlands earlier this afternoon highlighted adverse events, driveline infection at 42%. We offer a feature optional in the program that reduces the pump speed to 7,000 RPM for a period of 8 seconds that allows the flushing out of the aortic root and valve. In 2010, the Jarvik Heart Company made a major advance in design and launched the cone-bearing axial design. Now, with over 8 years in patients and on bench trial, there is no measurable wear of that bearing. Here's a little history of the regulatory status of Jarvik Heart, of importance to you here in the kingdom. I can share with you the fact that we have submitted and been working on the dossier to the Saudi FDA since the beginning of this year. And about mid-year, the authorities noted that this product is not just a surgical implant, it is also a home use product. So we have two aspects to our pending approval in Saudi Arabia, one for, of course, surgery and the other one for patient use, including full instructions for use in Arabic language, labels, and et cetera, to comply. We do expect approval from the authorities here in Saudi Arabia later this month. A trial that's ongoing in the United States, bridge to transplant, a mix of the INTERMAC score is an interesting point of view, and we have skewed our patient population to more than half INTERMAC 1 and 2. So we're measuring the performance of sick patients. Other data that is more pertinent, because we're referring to cone-bearing patients, I'll let you read that yourself. I don't have to comment on the survival rates. The data that we presented to the Japanese authority for our Shogun are also quite favorable. And a little view of the future. Jarvik is actively in the final stages of the development of a 15 millimeter, that's diameter, pediatric pump. The Jarvik 2000, just as a point of reference, pumps 1 to 8.5 liters a minute, and by virtue of its small size, will accommodate patients comfortably from 28 kilos and up. The Jarvik 15 will be accommodating patients from 8 kilos to 28. We have two clinical trials about to begin, one in the United States, multi-center trial for FDA clearance, and another one in a parallel trial in Europe, starting also in Q1 next year to gain a CE mark. The device itself, in terms of design, is similar to the Jarvik 2000. Some of you may be aware of a U.S. government-sponsored program to develop a VAD for pediatric use. The program started 14 years ago, 2004, with 5 participating companies. The Pumpkin trial, that's pump, kids, infants, neonates. Today, there is only one participant remaining in that trial, Jarvik Heart. Similar to what we have just seen from our distinguished colleagues in terms of developments. And shukran. Thank you very much.